Every business has customers that paid for half of something, then vanished. Money you already earned walking out the door. So I built an AI system that finds them, wins them back, and rebooks them automatically. A handful of patients at $100-something a session is thousands back on the calendar in a single run. Here's exactly how it works. So like I always like to do before any build, let's actually visualize what we're trying to build today. So I'm calling this my patient win-back system. And the business we're going to try to do this for is a physical therapy clinic. And so with this kind of business, what generally tends to happen, as you may imagine, is a patient may be prescribed a certain number of sessions to get rid of their problem. And so usually what tends to happen is a patient might book one session, a couple of sessions, before you need to prod them a little bit to go ahead and book the remainder of their sessions. And so what we're trying to do is find an automated way to nudge and help these patients book their next sessions. So the first workflow in this entire system is going to be the reach out workflow. We're going to run it on a weekly schedule that's going to look at our CRM, which has all of the patients and information about their appointments. We're going to use an AI agent to write the email, send it along with a booking link, and then we're going to send a Slack message to our team letting them know that these were the patients who were sent those emails this week. The second workflow is going to be, what if the patient actually books with us? We're going to track that as well. So we're going to identify that they booked the meeting. It's going to create a calendar invite. And then we're also again going to send a Slack message over to our team letting them know. And then finally, the third workflow is, what if the patient doesn't actually book and instead replies to that email with a whole slew of things? They could be asking the team a question that's related to their appointments, or then just something different altogether, such as parking information for how to park close to the clinic. And we can handle each response by letting our team know and actually drafting an automated message that we might want to respond back with. So this is the entire system. The system is also going to calculate how much money we were able to recoup as a result of doing this. So let's see how this looks like in action. I'm very excited. I hope you are. Let's dive in. Okay, so as you're seeing, I'm back inside my favorite place, Visual Studio Code. I have Claude Code's extension connected, and this folder also has the MCP details, which allows me to connect to an N8N. You'll see I have the prompt already on screen. Feel free to screenshot this as I send it over to Claude, and I'm gonna go ahead and ask it to start developing the workflow. In the meanwhile, what I'm going to do is I'm going to show you what the CRM for this is going to look like. Okay, so it's named patient list. You'll see I have two sheets down here at the bottom. The first is patients, the other is reply log. And you'll see it has the name, email, condition that the patient has become a client with us for. So this person has lower back pain, their last visit date, number of sessions completed, sessions prescribed. Their status is currently active, which means they're an active patient. And there are other columns to handle the rest of it. The contacted column, rebooked, and the outcome. Our reply log, this is for that third workflow that we build later on, where if a person responds back to the email that we send, giving them the booking link, whatever's going to happen is going to be logged over here. So let's head back to Claude. Okay, so you see it's spending quite a few tokens thinking through this particular workflow, and we'll see how it's going to take it step by step. All right, so it's come up with a plan, or starting to come up with a plan. It's identifying the things that it needs to do. The filter logic is in place, and this is for the code nodes that will appear in a particular node. Okay, so looks like it's finished creating the workflow for us. It says the workflow is live on the instant. Flip it active and see the whole engine get activated. So let's now head over to N8N and see what this looks like. All right, so I've zoomed into the workflow. This is the first one. It says PT patient win back. You'll see it's got two triggers for us. This is for us to test, and this will run on a weekly trigger. It's first going to look at that CRM that we saw. It's going to identify all of the patients that need to be reached out to. It's going to filter and build a particular prompt, and if there are any patients due, which means if they need to be sent reminders, and the logic for that is residing inside of this as to how many days it's passed when they actually had their last session. And so let's say if 20 days have passed since they last booked a session with us, they are due for a reminder. And if that happens, and if there are multiple patients identified, we're going to split them out one by one so we can write a personalized email to each of them. Before we actually trigger the workflow, let me show you what's happening in our CRM. So you'll see with these first few patients, they have booked their sessions pretty long ago. It's July right now. You'll see their last sessions are either in May or June. This one's last session was in April, but you'll see that they've completed all of their prescribed sessions. And so we won't or shouldn't be sending an email to them. So let's go ahead now to the workflow. And I've zoomed out. So this is what that full workflow looks like. And I'm going to hit execute and see what happens. So it's executing. It probably has patients because it went to the true branch. It's writing those emails. I think it's going to write a total of 3 to 4. So number 3 is on right now. Number 4 is on. It's sent or is sending the email, and then we should have the updates in the CRM as well. So you'll see it's posted to Slack too. So first, let's go ahead and look at our CRM again. All right, so you'll now see that it's updated the contacted for the first 4 patients to today's date, the 11th, correct? So it's sent or says it's contacted them. Now let's go ahead and look at our emails. Okay, so this is the email that got sent to Sarah. It says, hey, picking your lower back pain recovery back up, right? So it's actually looking at the CRM, seeing what Sarah is doing with us, meaning she's trying to get her lower back pain to get better. And so it's personalizing the email. And then this also has a link for Sarah to book an appointment with us. We're actually going to build that out, the tracking of the appointment and let's see what Slack looks like. You'll see within Slack we have this message saying recontacted 4 lapsed patients this week: Sarah, Michael, Amanda, and Emily, which are the same ones that we have in our CRM in our inbox. There you go. Sarah, Michael, Amanda, and Emily. Isn't this amazing? Now let's go ahead and build that second workflow. This one's gonna actually track if someone booked an appointment with us. All right, so I already sent the prompt for the second workflow off to Claude Code. What this one's going to do for us is going to capture the appointment and then even calculate the amount of money we were able to recoup as this patient is booking an appointment, a further appointment back with us. All right, so it's going through, it's creating the different nodes, it's creating the code that will be used in the code nodes, the fork branch, the sticky note as well. Perfect. It's also created a webhook for us. So this is great. Now let's go to actually cal.com, which is what we're going to use to book these appointments on. So this is cal.com, and what I've gone ahead and done is I have created a new session that's called a PT session. So this is an event actually on an event type on my cal.com, which you'll see is connected to my Google Calendar. One of the other things that we need to do, which is absolutely crucial for this to work, is go to webhooks. And what I've done is copy the URL that Claude Code gave me for the webhook node that it's created in the workflow for us. I'm going to show you how that looks like. But what I've done for now is copied that URL and pasted it inside cal.com. And so this is how when someone books an event through cal.com with us, it's going to know to send all of the information to N8N through this webhook so that we can pass it to our workflow. I hope that made sense. Okay, so I'm inside N8N. This is that booking tracker workflow. The first node that you see on here is the webhook. And what I've gone ahead and done is for the production URL, this is that same URL that we just saw in cal.com that we are passing over here. This is what is going to enable cal.com to be able to communicate with N8N. So once that's done, it's going to get the patients. It's going to match which patient booked an appointment. And then if there is a match, we're going to then mark that off in the CRM saying that they are rebooked, and we're also going to post to Slack. So this is a nice simple workflow, but let's look at it in action. You'll see it's active. It says the workflow is published on the top right. So let's open one of the emails again that we used to send a booking link and see if this execution is triggered. This is that email that Sarah had received asking her to book an appointment. Let's go ahead and click on book your next appointment. Okay, so it's moved to cal.com where I have this session or this event type called PT session. I'm going to book for Monday the 13th at 2 p.m. I'm going to hit confirm. You'll see that on cal.com, this meeting has been scheduled. Going back to N8N, let's see if this triggers an execution. You'll see it has already completed the execution. We should have been able to mark this person as rebooked. and also post it to Slack. Let's look at this next. You'll see in our CRM, Sarah has now been marked as rebooked on today's date. On Slack, we have said that Sarah rebooked was 4 out of 10, which means she had 4 sessions booked out of 10, which means now that she started to rebook with us, this could possibly give us another 6 sessions, and at $120 per session, this could mean that we've been able to recover $720. This previous message was just when I was testing this myself, but the one that I just showed you, the execution, is when this particular message at 12:02 occurred. This is my Google Calendar. You'll now see that this session has been booked from 1 to 2 p.m. on July the 13th. Isn't this amazing? All right, so this is the third workflows prompt that I shot over to Claude Code, and this is what it's building for us. It's got these 3 different steps. It's giving us the information, and it's giving us the workflow and the JSON. Let's actually go back to our initial visualized build and see what this is going to do. So this is that third workflow that we are building. What it's going to do is when the patient reply comes in, it's going to route it appropriately based on the action or the response that we get from a particular patient. It's going to send it to Slack if it needs human intervention, and we're going to see exactly how it behaves in each different situation. Okay, so it looks like it is ready for us. Let's go to N8N and see how this is going to look like. Okay, so this is what the workflow looks like. You'll see it's a little bit complicated with the number of nodes that it has, but let me just zoom in here so you can see clearly what might be happening. So we're going to have a Gmail trigger, which is going to get triggered when someone shoots us a reply on that same thread. It's going to then look at our CRM, see what we've done previously with that patient in terms of if we've ever received a reply before or not. Then it's going to use a code node. It's going to process it. It's going to classify the reply and then route it appropriately. It's going to ignore it if there's no match found, of course using an AI agent. And then if someone wants to book and says something like, hey, I'm ready to book, it's going to send the booking link again and then post it to Slack, also update the CRM in all of these cases. If that person has a question, we're going to draft a reply, not send it over immediately, but instead post it to our Slack channel. If a person says, hey, stop contacting me, we're going to mark it in the CRM and then of course let us know as well. And in case there's just some other random question, we are again going to post it to Slack just in case we do not want our AI agent to be writing random responses. So let's test each of these paths out one by one. First, let's test out the route where someone is ready to book. So this was the email Michael received. I'm going to draft a reply back to this email that he received saying I'm ready to book. I'm back inside N8 and you'll see the execution has completed, and you'll see pick the first route. It said that the booking reply has been sent again, the Slack has been notified, and also our CRM has been updated. Okay, so here you'll see me saying Michael Chen wants to book. I replied in thread with their pre-filled booking link. Let's see if the email has been sent out. Okay, so this is where we have updated Michael again. We are saying, so glad to hear from you, book your session. So we've sent Michael the booking link again. Isn't this amazing? We're going to now test out this second route where we just respond instead of directly respond with something else than asking to book. So this is the email Emily received. She was the one that needed an ACL rehab. We're going to send this out and see if our workflow picks it up. Okay, you'll see that this workflow executed. It is successful. And as I zoom into this, you'll see the route that it picked was marked as do not contact because we said I don't need any more sessions. Let's head over to Slack. So it says, hey Emily, never too late to pick up your recovery. We know life gets busy, sometimes take a pause. And then let's go to the CRM and you'll see the outcome is do not contact. Now it did mark it actually for Sarah, which is incorrect, but that's only happening because we're using the same emails for each one. This classifier is not exactly distinguishing between Sarah and Emily, but the logic with the workflow is absolutely right because in the real world, every client will have a different email and that actual email will be tagged to the response. Here's what building this actually taught me. The email was never the hard part. Anyone can blast out a "we miss you" message. The reason most AI outreach flops or gets a business flagged as spam is that it doesn't listen. It just sends. What makes this thing work in a real clinic isn't that it writes a nice note. It's that it behaves like a good front desk person. It knows the difference between "yes, when can I come in?" and "please stop." It hands the medical questions to a human being instead of guessing, and when someone says "leave me alone," it actually does. That restraint, knowing when not to send, is the whole game. An automation people trust, remember, books appointments. One that doesn't gets you blocked. So that's the whole thing. A system that finds the patients who slipped away, has a real conversation with each one, and puts them back on the calendar without anyone at the front desk lifting a finger. And this isn't just a clinic thing. Any business sitting on customers who started and drifted off can run the exact same play. If you want more builds like this, real systems for real businesses, not just hype, hit subscribe and send this to someone you know who's leaving money on the table. I'll see you in the next one. Take care. Bye.